It's that time of the week. It's a Tuesday morning, and joining us live, as he does almost every Tuesday, is Dr. Isaac Bogoch, infectious diseases specialist from Toronto General Hospital. Always appreciate the time, Dr. Bogoch. You know, a couple of weeks ago, you and I were talking, and we started talking about avian flu and how Canada seemed to be doing better than our European and American sort of friends or counterparts. But now, at least out on the West Coast, they're dealing with a bit of an avian flu outbreak in Abbotsford and Chilliwack. What should we expect to see now?
So there's a couple of things. One, there's a very tragic case of a teen who's infected with this and who's very ill in an intensive care unit. And we obviously wish that person has a very speedy recovery and a full recovery. But there's also outbreaks among on poultry farms as well. We know this virus is carried by wild birds. Wild birds get sick, they die, and they can impact farms, poultry farms and other farms. And sadly, if a human comes into contact with it, while it's not readily transmitted from mammal to mammal all that efficiently at this point in time, it still can be, and it can pack a punch. And that's sadly what we're seeing now. What we can expect to see hopefully exists, as I mentioned, I hope this person does well and recovers, but you'll also see public health and the Canadian Food Inspection Agency swoop in and quell this as quickly as possible so there's no subsequent transmission to humans or other animals.
Absolutely. And, you know, let's pick up on that teenager, because you mentioned it is a tragic case. I know, you know, medical experts are looking into this. I'm not sure if they've called on you to sort of, you know, weigh in, but it's obviously a pretty significant event. It's also a very rare event. And again, we're talking about an outbreak on the West Coast, not here. But, you know, when we think about, you know, bird flu, protecting ourselves, you know, what are some tips to avoid it? Does it, I mean, because we're looking at sort of visuals of like factory farms, you know, birds, et cetera, you know, that sort of thing. But it is something that could just be anywhere, like dead birds, that kind of thing?
Yeah, it is. So like you would not want to come into contact with a dead bird or a dead animal or a sick bird or a sick animal, be it wild or even domesticated. You've got to be very careful because, you know, dogs and cats, of course, can scavenge and pick up dead birds who have succumbed to this virus. So you got to be very careful around sick animals and, of course, dead animals. The other thing, too, is there's a significant focus at the human-animal interface, especially in farming areas and agricultural settings, you know, birds with cows, to make sure that there's a limited risk of transmission to humans if there is an outbreak in those settings. So you've got to be very careful and use the appropriate personal protective equipment. But, you know, currently, like right now, if you timestamp this conversation to, you know, mid to late November 2024, there is not widespread human-to-human transmission of this. It is not effectively transmitted between humans. The key here is we want to ensure that stays that stays the case and that stays the same. And so the fewer mammals infected, the better. That's why it's so important to quell this virus and these outbreaks, because the more mammals that get impacted, the more opportunities the virus has to mutate or change to be more readily transmitted between humans, which is, of course, what we want to avoid. Yeah,
that's such important context, Dr. Bogoch. Appreciate that. Okay, let's move east now, because in New Brunswick, there are more than 40 cases of measles being confirmed. Now a measles outbreak has been declared in part of that province. The initial case was travel related here, but of course, what are your concerns now about just like how it spread? And do you kind of see this as being connected to, you know, vaccine skepticism, which we've seen kind of a growing amount of lately?
Yeah, thanks for bringing that up. So, you know, inevitably, we're going to see cases of measles imported into Canada. There's a giant global resurgence of measles. People travel, and we're going to see cases imported into the country. But it's our duty, and we should have our vaccine rates high enough such that when we do see those imported cases, we don't see subsequent transmission. Why are we seeing subsequent transmission in the country? A lot of it is due to lower vaccine rates, and there's pockets of under-vaccinated or unvaccinated individuals. This is the most contagious infection on the planet. This will find a way to get into unvaccinated or under-vaccinated communities, and that's why it's so important to ensure our vaccine rates are high enough such that it doesn't explode or take off. 45 cases is a lot of cases, especially in the Canadian context. And this is one of those viruses where if you take your foot off the gas pedal and, you know, you have some lapses in public health programs and people aren't getting vaccinated, you'll see explosive outbreaks. We see it all over the world. We do not need to see that in Canada. This is preventable. Yeah. Sorry, I'm rambling, but the last point is vaccine hesitancy. That is one component of probably a multi-tiered issue that results in people not getting vaccinated. And it's a very important area to combat, very difficult to combat, but we need to really build back public trust in public health so that when people are presented with vaccines, they say, yes, this is a good idea for myself and for my family.
Yeah, okay, that sounds very necessary. Dr. Bogoch, we always appreciate the time and context. Have a great week. We'll talk soon.
Be well.